today to yet another chat presented by the E.J. Whitten Foundation Prostate Cancer Research Centre here at Epworth. I am joined today by Sean and Dom, our next generation of urology surgeons who are currently completing their postgraduate research through us as well. So let me first introduce you to Sean. So Sean is our junior doctor who has, having completed his medical degree here in Australia, in Queensland, has now come on board to join us to finish off, well, to complete his PhD, which he's doing through the University of Melbourne. Sean, welcome.
Thanks, Thili. Thanks for having me.
So great, thank you, Sean. And also we've got Dom, who's joining us today as well. He's also another junior doctor who's having completed his medical degree here in Victoria and is currently completing his Masters of Surgery through the University of Melbourne.
Thanks so much for having us here today.
Yep, welcome, Dom. So why urology, guys?
Well, yeah, look, it's a question that I think we both get asked a lot, wanting to pursue a career in the specialty. There are some pretty standard, typical answers that I think, speaking to a lot of people, they say, look, loving the type of surgery that we perform, the people that we work with. But I know that having conversations with Sean, like we have many times, something that's often come up with us and something that we've often really expressed a real desire to work with throughout our career is men. And obviously in urology we deal with a lot of men, and we often are seeing scenarios where men are disengaged from healthcare systems, having not seen doctors for many years, little problems that have been giving them, little issues that have been giving them problems over all these years, amalgamate and circle and spiral and continue to get worse, and then they eventually land on our doorstep, and we're often seeing these men at times maybe with a disease that is really far progressed, or maybe with not one problem but multiple problems by the time we often see them. Sean, have you ever had any experiences?
Definitely, Dom, and it's great that you bring that up. It's not uncommon that we see these sort of situations, is it? And I'm sure you've had as
yes.
well, Thili. And I just remember this one man who sticks out in my brain. He came into ED with not being able to urinate. So he was in a lot of pain in his bladder and his tummy. And then within 2 hours, he had quite a bad prostate cancer diagnosis given to him, and also another cancer diagnosed as well. So especially with prostate cancer where you don't have symptoms usually, but when you do, it's usually quite late in the stage of the cancer. So yeah, I think it's hard to see, and something that we're passionate about, men's health and being aware of it, your health before it gets to that stage.
So, following on from that though, Sean, why do you both think that often it's too late before, the men actually are diagnosed, or, too late before they come in to us, to see us?
Yeah. So it seems there's a bit of a reluctance with, obviously stereotyping here, not all men are like this, but I think we know that from research, a lot of men are like this. There is a reluctance to sort of engage, like you said, with the healthcare system and with their doctors. And I think it's multifactorial, a lot of factors that play into it. But one may be, the perception that coming to hospital is intimidating.
Yeah, I would agree with that.
Especially, maybe the doctors being intimidating. What do you reckon, Dom?
Absolutely. I think, I think even though we try not to be, we can appear quite unapproachable at times, when you have people coming from different social backgrounds, people that are coming, having lived maybe very remotely in rural circumstances or situations where they're not very used to interacting with doctors or other professionals. And then that obviously kind of spills over into so much as that they're then very apprehensive about hospitals, and the hospital environment seems very scary and foreign to them. And with that obviously comes the fear of potential bad diagnoses, I think, which is a major fear.
It does a lot of that, isn't it?
I think me and Dom were talking about it before, and giving a bad diagnosis, it's just as hard for us as it is for the patients. I mean,
Yes.
you know, it's really hard when we see someone, you know, maybe that we've built a relationship with through the healthcare system and then suddenly have to give them this diagnosis. It's very difficult.
And I was just going to say, I had a patient recently, and he'd never been to hospital for a long time, and for no other reason, right? So obviously he's been feeling a little bit unwell, you know, erectile dysfunction and frequent urinary, so gone to a very country, regional Australia. So had gone, seen his doctor over there. They then sent him across, and then of course he's now got a, you know, so immediately within 2 weeks, someone who's never been to a hospital, so you know how you're talking about establishing a relationship. None of that had happened. And then he'd had to see, you know, one of our urology surgeons. The next thing you know is that he's got a diagnosis. And then I came in because, you know, because of research work, so he's now coming onto a trial, but it was really difficult, you know, and the cultural compact, the cultural concept as well of just coming from the country to the city, so unfamiliar. And then remember telehealth, we were talking about this, telehealth as well.
Well, it's a great point that you pick up on with particularly the cultural differences, and kind of tied into that I think is a component of health literacy, but speaking more so to the cultural differences, I'd be interested to hear of what kind of scenarios you guys have encountered in your times with how cultural differences, you know, act as that barrier to men, you know, coming forward.
Yeah, I think it's a great point. We're so multicultural here in Melbourne, and I've spoken to you two already about it, but I'll give this example. When I was up on the Sunshine Coast in my internship year, I used one interpreter for the whole year. Coming down here, every second, third, fourth patient, you need an interpreter.
Yeah, exactly. Yeah.
From a nursing perspective, have you?
And also not only nursing, but you know how I spoke earlier a while ago with the both of you as well. Just also coming from an ethnic background as well. So you know, patient X that I spoke about before, he was a classic example, as in just, you know, Anglo-Australian, but from the country. So there's another impact of culture when we talk about as well, right? So the culture is so micro as well as macro. So the micro culture within Australia is not only just the ethnic population, but also the country.
Yeah.
And that's something that I found through nursing, having worked in country, Australia, as well as city, urban as well. So you find those two different things. But then the other thing is obviously ethnicity and how men perceive their health as well. So different ethnic groups will perceive it very differently, you know, and we are talking about function of an organ that is very much masculine. And so therefore, a lot of men, if they were to have a problem with that, then it's sometimes a problem with their energy and their source and their, you know, being men and being masculine and being the head of a family or, you know, things like that. So because of that connotations that goes with that, a lot of them actually don't discuss their problems. Or they put it down to the fact that they're just growing older.
I think there's one more thing, Thili, if you don't mind me cutting you off, is that you can't prepare for a diagnosis, no matter what you do.
So true.
And everything you were saying before, within 2 weeks they're on the trial, it all happens so quickly. This whole big bunch of information is put on you. I think no matter who you are, what culture you're from, anything, it's scary and it's daunting and something probably that you've never seen before.
Picking up on some of the points that we mentioned before about some of the barriers, I think, that are faced by these men. Personally, I think with doctors appearing unapproachable to men, I think that is a significant barrier. And I think for me, the way that I approach that is by approaching every patient individually. I'm going to have a different demeanour and my interaction is going to be very different when I'm seeing a man in clinic dressed in a suit, professional businessman from the city, as opposed to when I see a gentleman you know, from out rural, remote ways who's presenting to the emergency department at 2 o'clock in the morning. And I think it's important to tailor your approach to those men to try and make them feel comfortable in a situation and a scenario that's very foreign and very scary to them. And I feel that if I can try and make a difference and make them feel comfortable and almost consider me as, you know, someone that's on their side and in their corner, I think that's
definitely.
I think that really goes substantial way. Sean, have you
Yeah.
had any thoughts about this?
Definitely,
Maybe on that topic or some of the other reasons
Yeah,
or
no, I
barriers?
think you hit it right on the head, and I would just say, I guess with the cultural differences as well. I mean, the use of interpreters,
Yes.
great, and just I think involving family members is another thing that is so useful.
Yeah.
I'll say, especially with men,
Yeah.
involving their partners or
yeah.
other people telling them to go to hospital or actually go and do their tests and things. I know.
How many of the people that we see wouldn't have ever ended up
come
even coming to see us if it wasn't for their wives?
Wife, yeah.
Or,
Yes.
you know, it's
All the time.
Always. It is actually, it's so
Yeah.
anecdotally anyway, definitely,
Absolutely.
that, partners are the ones that often will say, you know what, I think something's wrong. Let's just go.
Absolutely.
Let's
Yeah.
just go. Yeah.
Definitely.
Absolutely. And I think, the idea, the health literacy, cultural differences and these potential bad diagnoses acting as fears and barriers, I think that's almost something that's all kind of packaged together and something that we can work to improve by engaging these men with their health and with the healthcare system at earlier stages. If we can improve the health literacy and dispel some of the cultural myths surrounding men's health, and particularly men's sexual health, this is going to enable us to have less bad diagnoses because we're going to be able to identify health issues at an earlier stage and nip it in the bud, much more so than when we are waiting years until they actually come to see us.
Definitely. I think the other thing too is it's sort of the same line as Movember and mental health.
Yes, I was
and
just
things
going to
like
bring that for this month.
Absolutely.
It's all good now.
Yeah, that's right.
It's all about being able to talk about it as well. It's just
And being open
It's
and
different,
stuff.
open and discuss it. Yeah,
so,
exactly.
So thank you for both of you, and I think I hope you've enjoyed listening to our chat and watching this as well, everybody. We encourage questions as well later on if you want to ask, and so we'll put down our email addresses, and so you're more than welcome to send through for us. So thank you everyone, and Thili signing off. Bye.